Why I don't know why I can't put an oximeter on this guy. It's kind of freaking me out.
Who's in the vehicle now?
This is an overview for Cat Medical, which is a mod for ArmA 3 that builds on the medical features found in ACE 3. This video is making the assumption that you have a basic understanding of the medical features in ACE 3, and if you don't, that's okay. There's plenty of great guides out there and great videos out there, and I'll make sure to reference one in the description. This guide isn't meant to be completely in-depth, and there's definitely going to be some things that we're going to gloss over. The main goal is to get you comfortable with using Cat. Cat Medical can be quite overwhelming, but in its current state there's only two major features that you need to concern yourself with, and one of those you are already dealing with presently, which is the circulation. So we're going to go over those individually. In terms of circulation, there's one major addition, and that is blood types. You can check the dog tags, and that will tell you your patient's blood type. You can then reference that with some sort of chart that will tell you compatibility, and inject the appropriate blood type. If you inject the wrong blood type, which is not good, you will kill somebody doing that. So the appropriate procedure is to take the painkillers, which are found in the magazine section, similar to immersion cigarettes if you've ever used that, as opposed to the miscellaneous section where you'll find other medical supplies. And you're just going to give your patient a lot of painkillers and hope for the best. Our next concern is Airways. These are the big thing in Cat Medical, and it's probably what's going to take the most time to learn. You have two major modifiers on Airways. One is obstructions and the other is occlusions. Both of these will prevent your patient from regaining consciousness in a similar way to blood levels in traditional ACE3. Obstructions, if you have no other equipment, can be treated with head tilting. Be aware if you move from a certain area around the patient, then it will stop tilting the head, so you can't easily work on other patients, and you can only tilt one head at a time. If you have the equipment and the appropriate medical permissions, you have a couple other options available to you. You can use a Gerdel tube, you can also use a King LT, or an AccuVac. Occlusions can always be fixed with head tilting. It might not work the first time, you might need to tilt the head quite a bit, but eventually you should be able to clear it. Again, if you have equipment and the appropriate medical permissions, you can use a King LT or an AccuVac. Remember, King LT is permanent, so AccuVac is a one-time gig, and you can easily return some sort of screwed up airway. But if you insert a King LT, permanent solution, you know that airway is going to be good. You can also have chest injuries that will play into the amount of oxygen in your patient, like pneumothorax, a second chest wound, in which case you would apply a chest seal to deal with that situation. In terms of miscellaneous other features that are added, you have AEDs and AEDXs. These are alternatives to using CPR in traditional ACE3, and they're quite effective. The AEDX in particular will monitor a patient's vitals for you and create an audible beeping, which is quite useful if you have multiple patients that you're working on. This, of course, becomes less useful if you're within grenade tossing range of your opponents. In terms of airway management, you have an oxygen monitor that you can use to reference how effective your treatment is in a similar way to blood pressure in traditional ACE. Finally, you have IV drip stands and stretchers. These have their uses, a lot more niche than the other stuff, and they definitely won't keep somebody down, but if you can learn to use them effectively, they can provide valuable and tangible benefits. That should be all the information that you need to appropriately transition from ACE3 to Cat Medical. Again, video isn't going to make you a master at this, so make sure to practice, make sure to actually get time with the mod. Wish you the best of luck, and I hope your games go smoothly.